Good morning, all. This is Richard, your clinical coordinator. The purpose of this video is to give you a quick and dirty rundown of how to operate the infectious disease response unit. If you're watching this, you've probably just been assigned a COVID truck, and you may be looking at all the PVC and the PPE and wondering, what did you guys get yourself into? No worries, we can complete this training in about 5 minutes and get you guys up to speed on how this should go down. There's a lot of extra steps, but if you use the PPE and the equipment correctly, it'll significantly reduce your exposure risk and get you guys home safely to your families. I'm going to talk fast, so I'm going to need you to listen fast and learn fast. All right, let's do it. So quick note about DHR. If you're doing a DHR COVID transfer, there's a different process. There's a white binder there in the driver compartment with maps and detailed instructions. It gets involved with the PPE that's provided by the hospital, but if you're doing just a regular discharge 911 or inter-facility, go ahead and follow this process. All right, so if you've been living under a rock, SARS-CoV-2 is going to be our pandemic. It's spread mainly from person to person through respiratory droplets. They either are suspended in the air or they land on your mucous membranes, and from there, the virus goes ahead and enters your body. The purpose of the IDRU is it's a specialty response vehicle. It has enhanced PPE and a patient containment apparatus. The reason we use it is for discharges, for interfacility transports, and even for 911 response to homes of patients that we know have tested positive for COVID. Okay, so PPE, this is directly from the CDC. And as far as donning goes, it's not really a difficult process. Masks will come after gloves, goggles, and then your gown, of course. So donning the gown, I'm not going to go over it. This stuff is very simple. You guys have been doing this. It's not really until you get to the N95s where you really have to worry about getting a proper fit. Make sure you're putting the bridge piece over your nose and you're securing it with the elastic. It should be good and snug. When you inhale, it should kind of collapse around and kind of suck into your face. When you exhale, you should be able to pass your expiration through the seams in the side. Putting on goggles, putting on a face shield, not difficult at all. And putting on gloves, you do this every day. Now, here's where it gets a part where you should pay attention. Gloves, gown, face shield, and mask removal. This is where most people get into trouble when it comes with the PPE. Infectious exposure happens most often during doffing rather than any other time during the procedure. So let's nail it down, okay? So you guys have your gloves, which you should be pinching there in the center of your hand and pulling outwards so you can roll it over itself. Then using your exposed finger, go underneath the cuff of your second glove and push it forward and roll both gloves into a ball. This way you should be able to discard them and not have to come into contact with the surface that was exposed. After that, go and put on another set of gloves. The next step is to remove your isolation gown. You can either have your partner unfasten you or you can do it yourself. Just make sure you kind of shrug it off your shoulders in a forward rolling motion. Pull it off over your arms and try not to let your hands actually touch the outside of the gown. Try using just the inside of it to roll it up and discard it. After that, you have your goggles and your face shield, which you should always push away from your face and out and away from you. Now the N95, make sure you're pulling up on the bottom strap first. And what that does is allows the bottom of the mask to hang so that, you know, if you were able to if you took off the top of the top strap first, it would actually dangle and fall down onto your neck. And what you want is actually to have the bottom strap to be removed first. That way it remains secured to the top of your head and you're able to remove the entire thing after that. So go ahead and discard it all into a biohazard bag and wash your hands immediately after you do this process. So the CDC recommends N95 with a face shield, a gown, and gloves. They'll also have an acceptable just regular face mask if you don't have an N95. But here on the IDRU, we have a full Tyvek suit with N95, goggles, a face shield, gloves, and even a hospital gown that will go over that. All that is stocked and ready to go for you in the shelves. And this is the minimum level of PPE that we're asking you guys to be using, okay? Of course, you see the big apparatus there on the stretcher. It's just it provides a framework for the plastic to drape over the patient and the stretcher. Remember, this is not an airtight barrier, but the reason we're putting this plastic over the patient is to be able to catch those droplets that they may be expelling, either through breathing, speaking, or even coughing and hacking, okay? It's clear, so it allows you to have a good view of the patient still and be able to monitor them. Now let's talk about getting this patient loaded up and everything. So put all your PPE on first before you go into the facility. Don't put the drape over the stretcher yet, just kind of have it rolled up and ready on the side of the stretcher. Go ahead and get your report, your paperwork, make sure that you know where the patient's going, you verify everything, that everyone's involved and that they're aware this patient has COVID and that you're going to be transporting them to their facility. Go ahead and make sure the patient has source control of some kind, whether that's putting a mask on the patient. If they're on a ventilator, go ahead and make sure you put the bacterial viral filter on the vent circuits. Just do everything you can to make sure you get source control. After that, the side piece of the PVC apparatus will pop out. It's a T-piece connector for the PVC. It's not very hard just to wiggle it out. Then you can slide the patient directly onto the mattress. Once they're on there, go and buckle them in to attach all your monitoring equipment, your blood pressure, your 4-lead, your SpO2. Go ahead and attach them onto their ventilator and all the IV pumps too if they're on them. And then once you're done with that, you can close the apparatus by reattaching that side piece, just slipping that T-piece back in its place. Go ahead and put the plastic drape up over the entire frame and the patient and clamp it using the 6 provided clamps there at the end points there of the bottom of the PVC frame, okay? You will be able to load the stretcher as usual. It will fit into the back, and as soon as you get the patient loaded on, turn on the evac system in the patient compartment. That'll allow the air that's on the inside to be purged to the outside. Now, driver, speaking specifically to you, make sure you doff your covering PPE. And what I mean by that is, of course, your gloves, put on a new set, and your hospital gown, and your face shield. Take all that off and make sure you're just wearing your Tyvek and your N95. From there, you can roll it up and put it into a biohazard bag that'll be outside of the unit, and then you can hop into the driver compartment and start driving. Make sure that the door and the window to the patient compartment is closed, isolating them from you, and that way we'll be able to keep the driver compartment safer and cleaner. Once you get to destination, before you start assisting with the unloading of the patient, put on some new PPE, a new covering, and then you can assist with the unloading of the patient and transferring them into the bed. So DECON usually happens here at Central Station, but if you're running back-to-back calls, it could happen there at destination. Open all the windows and doors to the ambulance and put on a new set of PPE to the CDC recommended level. Wipe down all the surfaces in the driver compartment and the patient compartment. Turn the evac on to continually purge the air. Use the most heavy-duty cleaning agent available and be thorough with the handles and the commonly touched areas. Once you're done with DECON, allow everything to fully dry and put your used PPE into the biohazard bag. Wash your hands. After that, you got to put the truck back in service. So you've deconned it complete. You have restocked all the PPE. It has fuel. It's parked here in the Central Station and it's ready to go with all the trash thrown away. Don't leave anything in there. Don't take any food on there, and don't take any of the binders or anything like that. Lock up the doors. If at any time during this entire procedure you have any questions, I'm available to you. Mr. Yanez, your critical care coordinator, is available to you. Reach out to your ops supervisor and your on-duty supervisor and rescues for any assistance that you guys have, any problems that may arise, okay? That's it. Refer back to this video if you have any questions and give me a call. Good luck, guys.